Andrea. My name is Mimosa Travis, and I am going to go ahead and do your physical assessment today. If you feel uncomfortable with anything, we're doing today, just let me know. Everything will be kept confidential, and, at any time you want to stop, you can, okay? Great. I'll go ahead and wash my hands. Okay. So, how's your day been today?
Good.
We're going to start with assessing and palpating your face. And with that, I'm just going to make sure that everything is symmetrical. You have a few blemishes on your face, but nothing to be concerned about. Your skin is even toned and looks pretty good. I'm going to also palpate your scalp and cranium. All right, there are no humps or bumps there. Scalp looks good. Hair growth is good. Everything is good. All right, and then we're going to start out. We're going to go ahead and palpate your temporal arteries. And they are palpable and not bounding. We're going to go ahead and assess your TMJs. And by that, I am going to palpate first. Make sure there's no pain, correct?
Mm-mm.
All right, and I want you to open and close your mouth. All right, open and close. All right, and open. Good. Test the strength of the TMJs, and there's no clicking there. Okay, and cranial nerve 5, I'm going to do we just tested cranial nerve 5. We're going to go ahead and do the swab test. And you just let me know if you feel this little soft, this little cotton touch your face, okay?
Yes.
Okay. All right. Also, we are going to test cranial nerve 7. And we do that by having you smile. Look toward the camera. Have you smile. Clench your teeth. Lift your eyebrows. Okay, close your eyes. All right, and puff your cheeks. Good. All right. Now, I'm going to go ahead and assess and palpate your ears. No pain or tenderness there, right? Okay, I'm just going to look inside there, make sure there is no drainage. And there is not any drainage. Everything feels fine. All right, I'm going to do the whisper test on you. And you just let me know if you hear me when I whisper, okay?
Yes.
Okay, and again. I always forget which side I'm doing.
Mm-mm. Yes.
Thank you. We're going to also do the Weber and Rhine test. And by that, we are going to use the tuning fork. And you just let me know when you don't hear, okay?
Yes.
Good. Okay. We're going to go ahead and assess your eyes. And we're going to look at your eyes. Make sure everything is good with your eyebrows. Everything is symmetrical. Your eyelashes have good hair growth. So do your eyebrows. Your conjunctiva is pink and moist. Pink and moist there as well. Scleras are white. Corneas look good, and your irises are brown. Okay, good. All right, we're going to test cranial nerve 2. We're going to do the Snelling chart right now, okay? And what I want you to do is stand up by the table. Right about there, okay? And I want you to read the lowest line that you can read at this time. Go ahead with both eyes first.
FELOPZD.
Okay, that's 20/25 for your vision for both eyes and your contacts in. Okay, cover one eye, I'm sorry.
FELOPZD.
All right, same with that eye, with the left eye. 20/25. Read again.
EDFCZP.
Okay, 20/30 out of the right eye. Thank you very much. You can take a seat. All right, I'm gonna do the extraocular test, and this is testing cranial nerves 3, 4, and 6. And you just follow my finger, okay? Just making sure that the eyes follow symmetrically, and they do. All right, I'm gonna test your pupils for responsiveness to light, and they are responsive to light. Both are. Okay, and the pupils are reactive, equal, and they're about a size 3. Great job. Also, we're going to test for accommodation and convergence. And what I want you to do is look away, far away, and then look at my finger when I tell you to, okay? All right, look far away. Look at my finger. Look far away. Look at my finger. And this test is just to make sure that when you look far away, the distance should dilate your eyes, and they do. And when you look close up, it should constrict, and they do that as well, okay? All right. All right, and we're going to go ahead and test, check out your eyes, your mouth and your throat. And I'm going to start with your lips, and they are good, moist, and pink. And your gums, they look good, pink. Teeth look good and white. Okay, open up for me. I'm going to look at your uvula, and it is intact and midline. The top of your mouth looks good and pink as well. Your tongue is moist and pink, and lick it out for me. And it is symmetrical. Okay, and I'm also going to go ahead and take a look at your tonsils. I'm sorry. And your tonsils look good. They are pink and number 1. The gag reflex. Good. Great. All right, you can close your mouth now. Okay. All right. All right, we're going to go ahead and assess your thyroid, okay? And what I'm going to do is I'm just going to press on one side and feel the other side, make sure everything is good and no lumps or anything there. All right, I'm going to do the same with the other side, and I'm going to palpate. Good. And the trachea is good and intact and midline. Nothing there. All right, we're going to do a swallow test. All right, I want you to take a sip of this water. And I'm just going to check to see. All right, good. And your trachea is symmetrical. Symmetrical there. All right, we're going to palpate. Excuse me. We're going to palpate the lymph nodes, okay? We're going to start with the preocular, I'm sorry. And then we're going to do the postocular. Good. The occipital. And the submental, submandibular, that's here, and then the tonsillar, and then the superficial cervical, and the post-cervical, and then the deep cervical chain, and the supraclavicular, supraclavicular. Sorry about that. All right, cranial nerve number 11. We're going to test that by having you touch your chin to your chest. All right, and extend your head back. Touch your ear to your shoulder, both sides. Great. Okay. And I want you to resist against my hand. Turn. Okay, good. Turn. Good. And shrug your shoulders. All right, I'm going to inspect and palpate your carotid arteries as well. Okay, and I'm going to feel good and palpable, no bounding, and I'm going to listen to them. Also take your carotid arteries for bruise. Good, there are no bruise there. We're going to inspect the arms here. Just hold your arm out for me. I'm going to take a look at it. And we're going to make sure There's no pain or tenderness there, right?
No.
Okay, and I'm going to go ahead and assess your arteries, and I'm going to do the radial artery first, and the ulnar artery, and then the brachial. Okay, and I'm going to do the same with this arm. We're going to inspect it first. No pain or tenderness nowhere. Okay, good. I'm going to do the brachial. Sorry. The radial. And the ulnar. Okay, and we're going to test the triceps and bicep reflexes, okay? All right, and I just want you to relax your arm there for me. And I'm just going to hit that tendon. Relaxed. Okay, and turn over and do the same thing. Okay, all right, I'm going to do the same on this arm. Let's do this one first. Sorry. Okay, and turn it over. And we're going to do the bicep. Okay, good. And we're going to also test the brachial reflexes. And you just hold your fingers together there and relax your arms. All right, good. See that one? Okay, good. All right, check your capillary refills. All right, they are pink, brisk, in less than 2 seconds. Great job. Okay. So now what we're going to do is test range of motion by having you flex and extend your elbows. Extend and flex. Good. And I want you to pull back against me. Resist. Good. Great strength. Okay. Also pronate and subnate. Great. And not hyper, but extend and flex your wrists. Okay. Now also pronate and subnate. Okay, good. And I want you to make a fist. Okay, open. Now touch your thumb with each finger. Good. Okay. Now, we're going to test the cerebellar function. And here what we're going to do is the finger to nose test. And I want you to touch my finger and touch your nose. Great. Also, we're going to do a test called Graphesthesia test. In this test, I'm just going to write something in your hand and you tell me what I wrote.
7.
Good. All right. We also have a test called the stereognosis test. And what I'm going to do is put something in your hand and you just tell me what it is that I place in your hand, okay? All right. Phil, close your eyes. I'm sorry.
A screw.
Okay. And that.
USB port.
Okay, and that.
A pill.
Okay, good. All right. Now, posterior and lateral chest I'm going to look at. First, I am going to palpate and inspect. Turn around for me. Just a little bit toward the camera. Good, we can see there. Okay, you let me know if you feel anything, pain, tenderness, or anything there, right?
No.
Okay, good. All right. So what we're going to do now is tactile fremitus. Tactile fremitus, you're going to yell 99 when I just press on your back, okay? And go.
99. 99. 99. 99. 99.
Okay, I'm going to test your symmetric expansion, and I want you to take a deep breath. Good. Great. And it is symmetrical. Breath sounds, that's good. Okay, now what we're going to do is percuss over your coastal vertebral angle. Coastal vertebral angle is like